Nigeria just made a groundbreaking move that could revolutionize healthcare for millions of Africans. But will traditional healers and modern doctors actually work together? Or is this just another government promise? The Nigerian federal government has announced an ambitious transformation plan that aims to elevate traditional medicine from the shadows of skepticism into the spotlight of mainstream healthcare. This isn't just about preserving cultural heritage. It's about creating a healthcare revolution that could change everything. During the 2025 African Traditional Medicine Day celebration held in Nigeria's capital Abuja, Dr. Iziaq Salako, who serves as the Minister of State for Health and Social Welfare, made it crystal clear that President Bola Ahmed Tinubu's administration is dead serious about this transformation. The government isn't just talking. They're putting their money where their mouth is through enhanced investments, tighter regulations, and strategic international partnerships. But here's where it gets controversial. Salako boldly declared that the administration is determined to transform traditional medicine into a reliable and respected component of Nigeria's entire healthcare framework. Some might ask, isn't this long overdue? Or are we rushing into uncharted territory? The government didn't come empty-handed to this announcement. Two groundbreaking documents were officially launched: a strategic plan of action for traditional medicine policy implementation, and the Code of Ethics and Practice specifically designed for traditional medicine practitioners. Salako characterized these documents as essential roadmaps that will guide both policymakers and practitioners toward achieving standardization, ensuring safety protocols, and maintaining quality assurance standards. Here's a statement that should make everyone sit up and take notice. Evidence serves as the crucial bridge connecting belief systems with policy implementation, Salako emphasized. The ultimate objective involves documenting, standardizing, and incorporating evidence-backed traditional medicine practices into Nigeria's comprehensive national health system. This integration promises to unlock opportunities for employment generation, local manufacturing capabilities, and enhanced healthcare accessibility for ordinary Nigerians. And this is the part most people miss. The government has already launched several concrete initiatives that prove they're not just making empty promises. A brand new Department of Traditional, Complementary and Alternative Medicine, TCAM, has been established right within the Ministry of Health itself. This represents a major institutional shift that signals serious commitment. The development of Nigeria's traditional medicine policy alongside the Nigerian Herbal Pharmacopoeia stands as another milestone achievement. This pharmacopoeia represents years of research, documenting more than 200 medicinal plants, along with their specific therapeutic applications. Perhaps most intriguingly, there are concrete plans to resurrect the Federal College of Complementary and Alternative Medicine, FEDCAM, which was shuttered back in 2010. This revival aims to significantly enhance training programs for practitioners who want to bridge traditional and modern medicine. Every single one of Nigeria's 36 states, plus the Federal Capital Territory, has received direct instructions to establish their own TCAM departments or governing boards. This directive stems from resolutions passed during the 62nd National Council on Health meeting, showing this isn't just federal lip service. International partnerships have been strengthened with heavyweight organizations, including the World Health Organization, WHO, the West African Health Organization, WAHO, and major countries like China and India. These partnerships focus on providing technical expertise and research support that Nigeria needs to succeed. Salako emphasized something that should make every Nigerian proud. The country's traditional medicine approach aims to harness indigenous knowledge systems to advance universal health coverage, UHC, goals, while simultaneously driving economic development. But here's the ethical twist that sets Nigeria apart. They're ensuring ethical research practices, implementing fair benefit-sharing mechanisms, and protecting the intellectual property rights of local communities who have preserved this knowledge for generations. Drawing powerful lessons from the COVID-19 pandemic experience, Salako issued a rallying cry for the entire African continent to position traditional medicine prominently on the global healthcare stage. The key to success, scientific evidence serving as Africa's passport to international recognition and acceptance. But here's a statement that might surprise skeptics. Traditional medicine and modern medicine should not be viewed as competitors, but rather as collaborative partners, Salako declared with conviction. He positioned Nigeria as ready and willing to spearhead Africa's advancement in evidence-based indigenous health solutions. The minister didn't stop at government initiatives. He actively challenged traditional healers, researchers, policymakers, and private sector stakeholders to join forces in documenting, standardizing, and commercializing Nigeria's vast phytomedicine resources. The ultimate goal? Attracting global recognition and substantial international investment. Earlier in the proceedings, Permanent Secretary Daju Kacholam, represented by her technical assistant Dr. Dogara Okara, made a powerful statement about this year's theme, perfectly aligning with the Federal Ministry of Health and Social Welfare's strategic vision. She highlighted the critical urgency of integrating rigorous scientific research and empirical validation methodologies into Nigeria's incredibly rich and diverse traditional medicine practices. We take immense pride in unveiling the code of ethics and practice for traditional medicine today, which will function as a comprehensive guiding framework for professional conduct standards, the Permanent Secretary declared with authority. This code has been carefully designed to maintain the highest possible standards of integrity, accountability, and patient-centered care among all practitioners. Adding international credibility to the event, WHO Representative Dr. Hamzat Omotayo delivered an important message directly from the WHO Regional Director for Africa. This message urged all member states to significantly strengthen their evidence-based practices and regulatory frameworks specifically for traditional medicine applications. Dr. Omotayo provided crucial context. For countless people throughout the African region, traditional medicine continues to serve as a fundamental cornerstone of their healthcare access and delivery. He reminded attendees that since August 31, 2003, African Traditional Medicine Day has consistently served as an annual reminder of the absolutely vital role traditional medicine plays in the daily lives of millions of people across the entire continent. This year's celebration centered around the powerful theme, Strengthen the Evidence Base for Traditional Medicine, bringing together stakeholders from every corner of the health sector. Participants included representatives from regulatory agencies, research institutes, and practicing traditional medicine practitioners themselves. But let's address the elephant in the room. While this all sounds promising, can Nigeria actually deliver on these ambitious promises? Will traditional healers embrace standardization and regulation, or will they resist government oversight? And perhaps most importantly, will modern medical practitioners accept traditional medicine as legitimate partners, or will professional rivalry undermine this entire initiative? What do you think? Is Nigeria's approach to integrating traditional medicine the right path forward for African healthcare? Or are there potential risks and challenges that haven't been adequately addressed? Should other African countries follow Nigeria's lead, or should they wait to see the results first?